Hello everyone, this is the last panel for the biomedical science track for Switch, and I am delighted to have four illustrious guests with me in the panel. I am Fabio Mola. I've been accompanying you for three of these discussions, and so I won't bore you with my introduction again. But what I'd like to do is I'd like our panelists to introduce themselves, starting with Sue. Sue?
Thank you very much, Fabio, for inviting me. I'm very pleased to be here with everybody. My name is Eong, and I'm Global Medical Head at Sanofi Pasteur, which is the vaccines business unit of Sanofi. This is a particularly relevant topic for me because, of course, our company, Sanofi, is very proud to be part of the fight against COVID in developing two potential candidate vaccines to contribute to this pandemic effort. And of course, we are also very much a part of the overall ecosystem in terms of maintaining health and well-being with our therapeutics and also consumer health products, which are also very, very key to helping to keep us all healthy during this very difficult and challenging time.
Thank you, Sue. Eong?
Hi, Fabio. Thanks very much for the opportunity to be on this panel and to be with colleagues that just really have made some accomplishments in their career. So my name is Yong. I work at the Duke-NUS Medical School. I'm a professor in emerging infectious diseases. I'm a clinician scientist by training, and my research is actually mainly to try and understand viral diseases like dengue primarily. But in the course of studying dengue and the related yellow fever vaccine, we've been able to take some of the lessons that we've learned from these the research that we've done to now work with Arcturus Therapeutics to develop a COVID-19 vaccine that uses a self-replicating mRNA technology to see if we can develop an effective vaccine against COVID-19.
Thank you. Tikki?
Yes, thank you, Fabio. Yeah, my name is Tiki Pang. I used to be a scientist. I'm an immunologist by training. At the moment, I'm a visiting professor at the Yong Lulin School of Medicine at the National University of Singapore. Previous to that, I worked with the World Health Organization here in Geneva, Switzerland, as director of its research policy division. In the context of vaccines, Heidi Larson and I are interim co-chairs of a newly launched Asia Pacific Vaccines Resilience Coalition. This is sort of hot off the press. We are hoping to launch it early next year. It will be based at the National University of Singapore. And of course, the implementation of the COVID vaccine is going to be one of the early interests of this coalition. Thank you.
Thank you, Tikki. And Chris?
Hi, thank you for having me on the panel. My name is Chris Caldwell. I serve as Executive Director of International Vaccines Public Policy at MSD. We're also known as Merck & Company in the US and Canada. We have a 100-year history plus working in infectious diseases and vaccine preventable diseases. And we're very happy to be part of the global collaboration to address this pressing pandemic. We have two vaccine candidates in early stage trials, and we also have an antiviral. But importantly, too, we see ourselves as a thought leader in shaping the vaccine ecosystem to make sure that the right policies and the acceptance are in place for COVID vaccines, but other vaccines more broadly.
Thank you, Chris. And clearly we've had some good news around the initial candidates coming online in terms of vaccines. Clearly, they still have to go through approval processes, so they're not yet out commercially. But there is clearly encouraging signs of good data from phase 3 studies. So I think the question that everyone is starting to ask is really, when will we actually start seeing these vaccines in action? And I guess maybe, Eong, if you can start with your views on that, and then we'll go from there. Yeah.
Yep. So, I mean, it has to be said that this is a very remarkable journey. I mean, with all sorts of records are being broken right now to get a vaccine from a point of just concept all the way through to demonstrating efficacy, even on an interim kind of analysis, is really, really, never been done before at this kind of pace. So that you now have 3 candidate vaccines that have demonstrated useful efficacy is I think a testimony to how we can bring the science of vaccine development as well as clinical trials into accelerating a solution for this pandemic. So I think in terms of when these vaccines will be available, I suspect they'll be primarily initially made available to those like healthcare workers and those who are vulnerable to severe COVID-19. Probably not enough doses to be able to spread to everyone. So the rollout will probably have to be prioritized by needs. But I think based on the company's announcements, it looks like it can be as soon as, say, beginning of January. But I think more realistic that it's probably going to be towards the end of the first quarter at best, if not the first half of the 2021.
Thank you, Professor Yi, on this. And what I was thinking about, Sue, is really around what we were discussing this morning around some of the issues that people don't realize what it takes to then take a successful readout from a phase 3 of a vaccine into a full production of it, and then the distribution. So maybe if you can give some insights on what that actually means to get a vaccine into the market.
Yes, indeed. And really the big challenge is really to achieve herd immunity. The estimates are you need 70% of the population to be protected. And for the world, that means 5.5 billion people, and that means over 10 billion doses if you need two doses of each vaccine. So this is the sheer volume of having to dispatch massive amounts of many different vaccines. That's going to be a massive and unprecedented logistical challenge. I think many people may not realize that even for vaccine production, when we make each batch, we have to make sure that every batch matches the characteristics of the batches that were successfully proven efficacious and safe in the clinical trials. And in fact, the total time we spend in manufacturing is actually spent 70% of that time in quality testing, not just the production. I can give you an anecdotal example of influenza vaccines, which of course we have to produce and distribute every year. This year has been unprecedented demand in order to prevent what's potentially a twindemic of both influenza and COVID happening at the same time. This year we're aiming to supply 250 million doses of flu vaccines. And they each contain 4 antigens. So if you multiply 250 by 4, that's about 1 billion doses that we have to manufacture and distribute over an 8-month period. And that's no mean feat to have, the planes, trucks, automobiles, refrigerated means by which you can transport vaccines to the actual point of vaccination. I think the big challenge that we have, and I'm really pleased that we have so many different platforms in this race for a vaccine. We will have to make sure that we can leverage the infrastructure that is available to actually then be able to immunize this sheer volume of individuals. And so I think that's going to be a big logistical challenge that we need all partners to really come together and collaborate around.
Yeah, and I think, in addition to that, clearly once the vaccine gets out of the gates, so to speak, where the logistics distribution is finished, I know as we were discussing with Chris and with Tikki previously, there is then the next set of challenges start when actually the infrastructure of countries that have to vaccinate people need to be robust enough to do that. And Chris, I know you've lived in Singapore for a while, so it's a region that is close to your heart, I suspect. And so maybe we start with you in terms of, some of the challenges that we were discussing around records for immunization, for example. So what else do you see once the vaccine is actually out of the gate that is necessary for us to think about as we start the immunization program?
Yeah, so maybe I'll start by saying too that I think this is an opportunity for us to strengthen our immunization systems more enduring after the pandemic. But obviously there's a lot that needs to happen in the short term. So I can name a few things. One is we look at delivery systems. And when we talk about delivery systems, we're talking about what are the mechanisms by which the vaccine makes it into the arm of a patient. You know, where does the patient go to get the vaccine? Is that at a traditional healthcare practitioner? Will we be expanding this to pharmacies? Are there other innovative places for people to receive the vaccine? And I think there's a lot that we need to think about with COVID, considering the unprecedented amount of immunizations that need to occur in a short time. Also, we can think about immunization information systems. So this is understanding who received the vaccine and having a proper record of that. And you can imagine the complexity of having multiple COVID vaccine candidates, which is good because we want to have multiple shots on goal. But we know that some of the early ones, at least, are going to require multiple doses. So you're going to be able to need to know who received the first dose when, who received the second dose when, make sure that they got the second dose that's the same as the first dose, and be able to record this and make sure that we understand what the uptake is. As Sue mentioned, you know, we ultimately want to get to a herd immunity, and having those information systems is going to be really important for that. So those are just two areas that I say we really need to focus on. There's more. And again, I think that there's a lot of investments that can and should be made in the COVID pandemic that also will have returns on investment in a long term in terms of strengthening our immunization systems.
May I add one point as well?
Please,
I totally
please
agree with Chris. I think one of the challenges in this region is that perhaps we're much better at vaccinating children, and much better than adults. And that could be one of the big challenges when we know that for COVID, that most of the early target groups, they're going to prioritize the elderly and of course the critical essential workers, and these are adults. And so today, I think there is also an opportunity to start really recognizing the importance of this concept of life course immunization, that you can continue to prevent vaccine preventable diseases well past childhood, and in fact our seniors actually deserve to have more of prevention to actually help them age in a more healthy way as well. So I think that's going to be one of the things that it would be great to see after the pandemic, a better appreciation of adult immunization.
Yeah. Tikki, I guess just to reprise some of the themes that Chris has mentioned before, and to a certain extent Sue, clearly there is a significant government role in the vaccination program. Wearing your WHO hat, what do you see the WHO role to be in supporting governments as they go through the thinking of a massive, mostly adult vaccination program?
Yes, thank you. I think the key role for WHO, maybe one of its most important core functions, is really to set norms and standards and best practices, based on the science that's available. So clearly, with multiple vaccines coming online, and bearing in mind that the capacity of the countries will vary greatly in the context of their own health systems capabilities, given what's already been mentioned about logistic issues, about the need for different storage temperatures, etc. So the role of the WHO really is to follow the science, to give, I would say, fairly generic guidelines, principles of best practices, but at the end of the day, it really, the final decisions in terms of the operational aspects of the delivery, that will rest with the countries. WHO is not in the business of telling countries what to do, basically. It follows the science, and then it's up to the countries to implement based on their own limitations in terms of resources, capacity, information systems, etc.
Yeah, and one question that was going through my mind as we were discussing the challenge of an adult vaccination program was that there is an existing parallel in a sense, which is something that and Yong, you've been studying actually quite a bit, as far as I understand, which is dengue, where the vaccine is essentially targeted at a very similar cross-cut of the population. If you take sort of 65 and above, which is questionable in terms of potential vaccination, but just getting your thoughts around how sort of compare and contrast how Singapore would be able to do something like this versus an Indonesia or Philippines, where there is clearly a lot more challenges.
Yeah, no, that's absolutely right. I mean, I think in Singapore, being a relatively small city-state, and most of us are actually have good access to primary care clinics and all that. That I think the vaccine rollout in Singapore would be a lot smoother, I think, compared to other places in Southeast Asia, particularly in those where you have people living in villages that are quite far away from healthcare centers. And so, how the vaccines roll out in Singapore will probably be very different from how vaccines will be rolled out in many other countries. Some the healthcare worker may actually have to go to the people rather than have it the other way around, where you bring the vaccine to the villages rather than expect the villagers to come to the clinics.
Mm-hmm.
But I want to add to a point that Sue made earlier, and maybe I'm being a little bit more guarded and a bit more pessimistic, I guess. I don't think 70% is enough, because all the vaccines so far have only shown the efficacy in preventing COVID-19. If you look at the phase 1, at least the preclinical data, animal studies and all that, a lot of these vaccines have not been able to prevent infection. Now, I think no doubt that
it's an important distinction, though. You're right.
Yeah, that's right. So you can be vaccinated and you'll be protected against getting COVID-19, but that doesn't stop you from carrying the virus. Now, I think the likelihood of someone spreading without symptoms is a lot lower than someone who is actually actively coughing and sneezing. But nonetheless, I think we have to be a little bit perhaps guarded until we have good data as to what the vaccines can do, whether it's just preventing disease or whether it can actually prevent infection. It's a little bit like polio vaccine, that the first polio vaccine, the inactivated form only prevented disease. It did not prevent carriage.
Right.
So,
Yeah,
you just have to take that.
Absolutely. And I think that, that brings up an interesting point, and I think Sue referred to it as she was speaking, which is also the fact that you do have to reach a base level of immunity within the population to protect everyone. And the issue is that base level of immunity is true within a country as it is true globally, because as we've just shown in the last 6 months, no one is immune from getting this because of the way the world is interconnected today, much more than it used to be. And so one other thought that comes in is, beside the sort of internal sort of cascade of vaccination, which is most likely to be health workers, then older comorbidities, et cetera, how should the world coordinate this response? Because the reality is that if someone is not vaccinated, there's, as you mentioned, before, someone is not vaccinated and is still a carrier, you still risk taking the infection everywhere else.
Right. Absolutely. No, I think at the end of the day, although we can have, like as Tikki said, that WHO can set the standards, have a guideline on what could constitute best practice and all that. At the end of the day, a lot of it has to take into account the local situation. And when you roll out the vaccine, I think the local situation matters more than what we can hope to kind of standardize internationally. For instance, if there had been a vaccine, just say about 4 months ago, besides the healthcare workers, I would bet that in Singapore we would have vaccinated our migrant workers, because that's where the actually was, right? So it need not necessarily be healthcare workers, the elderly, followed by the migrant workers, especially when the outbreak is happening in that particular group. So I think there will be local nuances, and we just have to be prepared for that. So I think it's therefore really important for public health systems now to at least start to consider what are the logistical challenges and how they're going to meet those as vaccines come online.
And so, and maybe that's a question for Chris, Tikki, and Sue, in terms of what do you think the key investments are that actually health systems do need to make ahead of, pretty much over in the next 2-3 months, because the time is of the essence at this point. There isn't much left, really. So maybe Sue, if you want to start, and then I'll go around the table.
I actually want to bring up the topic of confidence. Because there's been so much information in the media, sometimes true, sometimes myths that's being spread, and this is the crisis now is actually that if you allow a misinfodemic to spread, unfortunately, that creates very, very poor vaccine confidence, vaccine hesitancy. So that's the other major barrier to getting 70% uptake of vaccines. So even if you solved all of the logistical challenges, but people are fearful and don't want to receive vaccination, then you won't meet the goals. So I think that we really need to invest in building up vaccine confidence. I think that's critical, not just for the COVID vaccines, because already we're seeing vaccine coverage suffer during the pandemic in many countries where their routine immunization coverage is also reduced. So there's a lot of effort we have to do now to make sure that people really value and can break down those barriers to trusting vaccines and to actually accepting the value that vaccines can bring to society.
Absolutely. And Tikki, how do we build confidence, right? You mentioned before about the coalition, so I know it's something that is close to your heart in terms of things that need to be done, not only for this vaccine, but really across vaccines. And so, what are your thoughts around this topic of building confidence in a vaccine that, as Yong was saying at the beginning, has been actually breaking records, which can be seen as a very good thing, but from someone that sees it as a negative issue, or too rushed, etc., can be actually against confidence building. So there is specific things I think that are relative to this vaccine that are unlike others. So curious to hear your views on this.
Yeah, thank you very much. I think Su Ping has raised absolutely a central challenge, which is restoring confidence and into the process of vaccination. And I think, in my view, the main way in which we can do this is obviously through communications, good advocacy, having people who are knowledgeable to actually make the effort to try to sort of change the mindset. Because, I think Chris mentioned this in our earlier discussion, that most people are not dead against vaccination. Okay, on the other end of the spectrum, there are people who already are believers. It's that group in the middle who are sort of not sure, but with the right approach coming from the healthcare professionals, from community health workers, explanation, based on science, based on simple lay language. I think that's the way to go about it. It's complex, it's probably logistically difficult, but I really don't see any way around it. It's got to be sort of a more humanistic approach. And most of these people are educated. So I would say communications, advocacy, raising awareness. And I just want to perhaps highlight another challenge in addition to the confidence challenge, and that is, I think the other big challenge as these vaccines are rolled out is to have robust surveillance and monitoring systems, because it goes back to what Eong was saying earlier. Yes, you have 90% efficacy. What you don't know is the effectiveness when it's rolled out in the real world. Okay, it's 90% in 30,000-40,000 phase 3 clinical trial participants. What happens when it's rolled out in millions of people? In vaccinology, that's a critical difference between efficacy and effectiveness. And that's the kind of surveillance that you need in order to answer that question of how much herd immunity you would need.
Yeah. And just a favor to that I want to ask the other panelists, all that thought on the surveillance, because I think it's a really important point, and it's one that we want to go into. But before we leave the confidence, one of the things that I wanted to hear Chris and Sue opinions on is social media. So I'm Italian, as some of you have guessed, and in my country, misinformation around vaccines goes through those channels like there is no tomorrow. It's like the worst place to get information anyway, and on vaccines is even worse than worse. So long story short is, how do we actually think about an effective confidence building exercise that also takes into account novel communication means and counteracts the misinformation that does happen in those? Chris, maybe if you want to start, and then Sue, I know you have strong opinions on that as well. So,
sure. So a few thoughts, and I'll build a bit more on Peing and Tiki's really good point. So I think when it comes to education and making people aware, there's a lot more that we can do proactively. As Tiki mentioned, it's actually a small population that is, really against vaccines, but they can be very vocal and outside. And they don't always use science in their messaging, which is a challenge. But there's things that we can do more proactively to get the positive messages of vaccines out there. I think that's one. And also it's really important for governments and stakeholders to very proactively understand when there is misinformation, to address it very quickly before it goes viral. And I think there's been positive steps taken by some social media companies. I think there's probably more that still needs to be done. But to me, that's something related to social media. The other thing I think I would say too is, when it comes to educating the public about vaccines, understandably, people are maybe a little confused or trying to understand, like, how is it that these vaccines came about so quickly? I think what's important for people to understand, and what's important to be communicated, is that there have not been shortcuts taken in the data. What we've done is we've taken a number of steps that may have been done sequentially, where you do step one, you wait, you do step two, you evaluate, you move on, and we've overlapped them. Now, that means that we're not taking shortcuts on the data analysis. What we're doing is we're taking more risks on the resources that are used. For example, we're beginning to build manufacturing facilities in anticipation of the approval of the vaccine. Now, there's the risk the vaccine won't be approved, and therefore those investments in those facilities, were wasted. That's not something you would do in routine times, but in a global pandemic, you're willing to take on those risks. So that's just another thing I want to highlight, that it's really important that the communication goes out to people so that they can understand in a way that makes sense to lay people. I know there's a lot of health literacy that needs to be considered here, but help them understand that, the risks that are taken are the resource risks. It's not risks in the safety analysis. So those are some comments, and then over to Peing.
Thanks, Chris. I totally agree with what you said. Maybe one additional aspect we can continue to communicate on, because one of the things that people look to when whether or not they trust vaccines is also how much they trust their governments and their health systems. And I think we need to make sure that people also understand how thoroughly reviewed all the data will be from efficacy, from safety, from the quality of the vaccines by independent regulators, and they are also not really cutting corners in terms of the rigor of the scientific assessments that they're going to make. And maybe linking back to what Tikki had also said previously about the importance of real-world monitoring, real-world effectiveness, real-world safety. Those are things that will continue even when the vaccines are already in the market, and will continue to help. We need to continuously inform the communities of new findings, so that they know that they're being looked after as well in terms of the impact that the vaccines are actually having. And maybe linking back again to Chris, your point earlier on about vaccine information systems. I mean, this is really the value that digital actually tools now allow us to do is actually we can gather that information so much more efficiently now. And it would be great to see governments and the academic stakeholders, the health systems, work together to use the electronic health registries, to use vaccine information systems, so that real world data can be analyzed much, much more quickly than ever before. And I think that would also give confidence to the public that they're going to, if anything's going to be identified, we'll find it out very, very quickly.
Yeah, I mean, and back on the point of surveillance, right? We should say that the systems do exist. We've seen vaccines issues come up. Lastly, for example, in Indonesia, when there was a batch, there was actually a fake batch of vaccines. That was about probably 2 years ago, which was picked up by surveillance systems, even in countries where you wouldn't necessarily expect a strong surveillance system. But I think that what is interesting about the surveillance system is the sheer amount of data they will have to actually analyze. So as you were saying, hopefully digital will help on that. I don't see yet some countries being able to handle that volume of data that will come out of this specific vaccination program. I don't know what your experience is in this. I know you've been sort of on the medical side for a vaccine company for a while now, so you're probably well familiar with the challenges of that.
We're really working hard to make sure that we can, certainly in North America, in Europe, there are robust systems that we can leverage to actually gather the real world data and work with third parties and stakeholders, with national registries. I think that really is revolutionizing how we can be even more confident about the results that we see, about the impact of vaccine programs, because of that volume of data, that volume of evidence. I would certainly hope that we can leverage some of that data to also provide reassurance to the rest of the world, as over time the rest of the world also starts to be able to pick up on these more modern ways of analyzing health data.
Yeah, if I could just add quickly to that.
Sure, please.
Yes, I think the digital revolution, clearly great potential in the future. But the big issue that some countries face, and I'm referring to my own country of Indonesia, is the interoperability of those data collection systems. That's a huge challenge. We have 35 different provinces and everyone's doing their own thing. And to seamlessly make those data comparable, it's going to be a huge challenge. So that's one, I think, a bit of a devil's advocate, as you said, Fabio. I'm not sure how many countries are really prepared to really fully realize the potential of the digital revolution.
Yeah, if I look at it, so the question that I've asked before around investments, right? That's one area where I would really put some money on, is digital, electronic records, surveillance, because I do think that to build that confidence that we were discussing before, yes, it's true that there is a human touch, as Tikki, as you were mentioning. There is also a data side to say, look, 99% of the people were receiving the vaccine, and there is no specific issue that has arisen from a mass vaccination program, which would be a fantastic news to be able to give if you can rely on the data, and if you do have that data collection and analysis capability, which is also a separate issue. Yeah. So I think that is one place where I would want to see more investment, because while I do think that there is a reasonably good surveillance system, both from an industry perspective, but also from a government perspective, what I'm worried about is the sheer amount of data and information that will go through that system in the span of a few months. I don't think we've seen it before. So, yeah. And one other point around barriers is, so we've sort of talked about the obvious ones, the logistics side, the surveillance side, but also one barrier that we haven't particularly explored is, how do we actually get the people vaccinated, right? Where do they actually go for it? And I know that, for example, Tikki, at the beginning you mentioned You know, in certain countries, they're doing it in the US, for example. In the US, they're doing it in pharmacies. But we all know, for example, in Philippines, there is a very few set of doctors that can vaccinate. Similarly, in Indonesia, it isn't everywhere. So, Eong, maybe you can comment a little bit again from your dengue perspective, right? Where do you think vaccination is actually going to happen for COVID-19? And then clearly, if you guys have any other views, please feel free to go on.
Yeah, well, I think given the pandemic, I think this becomes a public health priority. So, you know, I think vaccination will probably start as soon as possible. Now, obviously, the rollout will probably be very different from country to country, or even from, you know, town to town. And so there will be those local factors that will be taken into account as to what's the best way of dealing with logistics, right? Be it cold chain, be it, you know, just communication, whether the public will come forward or you have to go to them. But I guess, you know, the one thing that I just want to add to this is, you know, besides just, one way of encouraging people to come forward is to, you know, kind of assure them that the vaccine is safe, as I think Chris, Tikki, and Peing have all emphasized earlier. The one thing, though, is that, you know, unlike clinical trial, when you roll a vaccine out, there's no placebo to compare with. So whatever that we're seeing now, we can confidently say that this vaccine is safe because we can always compare it to placebo. There's a comparator arm because there's always side effects. People will always complain of something. When you roll it out, the fear of the one potential pitfall is that if we don't pick up problems early or communicate that, you know, these are unlikely to be associated with the vaccine, but rather, you know, just the cost of you know, taking an injection or something like that. If indeed people do start complain and the complaint spreads quickly over, you know, social media, then that could undermine the entire effort, right? So I think yes, the logistics is one part of it, but managing what we know about this vaccine and how do we then communicate, you know, the expected side effects and what would be expected and what's completely unexpected and completely unlikely to be caused by the vaccine needs to be communicated probably quite regularly over the course of the rollout. Otherwise, you know, one undesired event could completely derail the vaccination. And we've seen that with dengue, right? With the dengue vaccine.
Yeah,
just
absolutely.
One an event that was not properly managed could completely derail an entire program.
Yeah. And I guess, you know, on that note, whose responsibility is it at the end of the day to actually make those communications? Clearly, you know, as scientific community, as industry, pharma, we have a responsibility to do that. You know, university, WHO, etc. But who should be monitoring the thousands of different platforms that this can go through? You know, who should be regularly divulgating about the vaccine? How do we coordinate that? Because it's a non-trivial effort given the amount of misinformation that can happen very, very quickly.
Yeah, no, you're right. I think it's all of us have a role. You know, the public health for sure, the government, public health, you know, the companies. And I just want to add that even scientists like myself, right? And you know, I'll be first to admit that science have, you know, the way we are trained and the way we write our scientific papers and all that, the way we present our work, we speak to one another, but that's just about it. We're communicating with our own kind. But whatever that we have, whatever knowledge that we have gleaned from our research is not being consumed by the lay public, simply because we don't communicate with them. And when we do, we use words that they don't understand or possibly even switch off. So I think we you know, in science and medicine need to do a better job, and we all need to engage. If not, you know, this whole thing will just drag on, and we will never bring this pandemic under control.
Absolutely.
Indeed. And maybe if I can add, of course, yes, industry has a very important role to play as well, because we have to have robust pharmacovigilance systems in place in any country where our products are being used. and to make sure that any rapid signals can get rapidly assessed. And that's why I come back to, if you have access to good data, that really helps to speed things up in terms of distinguishing from a real signal that you should be worried about versus something that's purely coincidental. And then being able, as Eong said, really translate that into language that the public understands and can appreciate, not use jargon, which could then unfortunately have a repercussion effect, which takes people off to the wrong ideas and the wrong perceptions of vaccine safety. I think it takes all of us to do that together. And I'm really pleased to hear that, Tikki, you're also going to be starting this vaccine confidence initiative here in the region with some of the leading vaccine confidence leaders in the world.
Yeah, if I could just add quickly to this media, please. Social media and misinformation. I think Chris has already alluded to it. And I know that most of the major companies that's involved in this world, if you like, I mean, talking about Facebook, Twitter, Google, they're actually already doing their bit in terms of trying to minimize the misinformation that's sort of floating around. They have been able to disable certain search engines for certain terms. And more importantly, many of these major platforms, social media platforms, have incorporated a sort of a capability where whoever searches for that kind of information is directed to reliable, credible information sites, including the WHO. So I think there is a little bit of sort of advance in that regard. I call it social responsibility, whatever, but I believe that link to credible, reliable, trustable, I guess, information sources is one way in which these companies have tried to overcome that problem.
Chris, maybe I'll also add one other element.
Yes, please.
Yeah, I think I agree with everything that was said. And I think another opportunity and a need here too is to engage communities, and meet people where they are, both physically and from a health literacy perspective. And community leaders, I think, can play a very important role in becoming ambassadors to help educate their constituency. So I think it's really important to engage at that level as well. So I just want to add that.
Thank you. And there is one last argument or one last topic that I wanted to touch on, in the last sort of 10 minutes that we have for this panel, which is really, we've dedicated 40 minutes now to talking about the COVID vaccine, but clearly there is a number of other health issues that have been postponed, that have been sidelined by the attention that COVID has received, that have been sidelined by the patients that have actually gone into hospitals instead of the oncology sufferers, instead of the routine vaccinations, instead of the diabetes sufferers, etc., etc. So in terms of your view of two things, I guess, and I'd like a round of the table on this, of two things. Number one, what do you see the biggest issues that COVID has created in the rest of the health system in terms of things that have been sidelined? And I know vaccination is clearly one of them. And second, how should government think about, once the emergency is over, to restart those services that have been unfortunately put on hold? So maybe Chris, if we start from you and then we just go around.
Yeah, we're really concerned about the drop in vaccines coverage rates due to the pandemic, because as you said, we have to remember that obviously we're facing a terrible disease with COVID-19, but there's many vaccine preventable diseases, and we're at risk of losing ground and losing investment if VCR, vaccines coverage rates drop. So I think it's really important to build a confidence and reimagine, as I mentioned, our delivery systems so that vaccines, the one that patients and consumers have the confidence that they can receive vaccines in a safe manner, and then also be able to rethink how we deliver vaccines and be innovative, whether it's expanding scope of practice or perhaps it's with mobile clinics. And again, it's going to look different in different places. It all has to match the local context. I also want to go back on something Peing raised, which is, we generally have what we'll call like a strong infrastructure for pediatric vaccines. I mean, there's improvements that need to be made, but we need to also think through the life course. And when it comes to adolescent and adult immunization, that's where we have less strong systems, less strong infrastructure. And I think there's really important need through this pandemic to, again, like reimagine and invest in those delivery systems, not just from a pediatric perspective, but across the life course, because it's really important that we retain vaccine coverage rates for vaccine preventable diseases other than COVID. And again, an opportunity for us to invest in these systems so that we can have stronger systems at the end of this pandemic.
Tikki?
I would say, I think, in my view, the most important issue that perhaps needs attention, and it's probably also related to COVID, and that is issues around mental health. Clearly, the pandemic has really stressed the system in the context of increases in alcoholism, domestic violence, suicides, etc., etc. And I think that needs to be addressed. Unfortunately, many of low and lower middle income countries just do not have that capacity in terms of psychological counseling, psychiatric support. So in the context of a restart, it goes back to surveillance. Do we have good data in terms of the kinds of mental health issues that need to be addressed? And then, make sure that your health system has the capability to deal with it once this whole thing is over. Because as we know, mental health issues is not just something you solve with a 7-day course of action. It's going to be long term.
Yeah, absolutely. It's going to cause long-term pressure on the health system as well, as much as also, the vaccination, as Chris was referring to before. The other big issue is that the results is going to show up in 10 years' time when people that haven't been vaccinated for HPV are going to show up with cancers back in hospitals, and so probably 10, not 10, but 20. But anyway, yeah. Eong, sorry, your turn, I guess.
Yeah, so I think one obvious thing that's happening now in many places is that if you have fever, then you try and delay going to the hospital because you might get quarantined, right? So and this has gone on for a while, right? It's not just possibly just febrile illness, but perhaps even others, like patients with cancer, they'll delay treatment or follow up or healthcare seeking behavior and all that for the simple fact that it's a lot, the screening process and all that in hospitals a lot tighter. Once you go in and there's a fever, they on some occasions it's mandatory that they have to test for COVID, and the minute they're testing for COVID, you're quarantined until the result is out. In Singapore, that requires 2 negative PCRs. That's going to take at least 48 hours, if not more. And during that time, you cannot see your family members. You cannot, you have no contact with the outside world except through the phone. It just puts people off, that they will try and delay it as much as they can, and I'm not always a good thing. And this year in Singapore, concurrently, we had our worst dengue outbreak ever in Singapore, with 32,000 cases and counting so far. So, and the fear, of course, is that you mistake COVID for dengue and dengue for COVID, right? And so the minute you show up with a fever, you'll be put into isolation until proven to be PCR negative for SARS-CoV-2. And yeah, it's stressed a lot of people, as Tikki said, right? You're not only having an acute illness to deal with, but you also have the mental health issue now added on top of that.
Yeah, absolutely. Peing?
So I mean, I agree with what everybody else has said. Maybe just come back to pick up a point that Chris mentioned about reimagining healthcare. I do think that there is an opportunity here as well, because some countries have managed to use, for instance, telemedicine services, ways in which they can get prescriptions home delivered to patients at home. ways in which we can leverage technology to ensure that patient care does not diminish because of the fear of being able to walk into a doctor's office. Vaccination is a bit harder because you actually have to present in front of somebody to get immunized. But even then, there's been such innovation in people doing drive-through vaccinations. Of course, the using different services such as well baby clinics, even well adult clinics now for adult immunization. So I think what I would hope is we don't wait until the end of the pandemic to try and catch up, because I think that would be a disaster. I think we need to actually put some of these solutions in place even now. And we come back to the initial question you asked, when will vaccines be available? I mean, the reality is for the whole world, it's really 2022 before everybody is probably going to have access. So we can't wait that long.
Absolutely.
We have to put some of these solutions in place so that other health interventions can still continue to be delivered. So that would be my hope, that we all work together to not wait till the end of the pandemic.
Thank you for that. And we have a couple of minutes left. I wanted to do one last thing, which is, given that finally we do have a vaccine and the data is good, what are you guys looking forward to be able to restart, redo once you're vaccinated? Sue?
Well, travel, I guess. It's so ironic. I probably spent so much of my last year in a plane and in another country. And I've been in Singapore now for the good part of this year, and I am missing just that ability to just leave the country and go to a new location and just see people, right? and have a meal with them.
Eong?
Yeah, I think for me, it's just to be able to see family and friends again without the restriction to 5 people per table, something like that. So my mom lives in Malaysia. I haven't seen her for more than a year now.
Oh wow!
So it'd be good to be able to travel and see family and friends again.
Chris?
So I think for me, like everybody else, family and friends. My partner and I love to dine out, so do that a bit more. And of course, I do miss travel, but I also think we're talking about reimagining. I think there's an opportunity to reimagine business travel. There's some business travel I miss, and frankly, there's some business travel I don't miss. So maybe we can be a little smarter about what we do. But I do miss it, and I find that that personal interaction, working with colleagues, I miss that. I think it's still hard doing some things over Zoom, particularly when you're working across cultures, to really get to understand people. So I miss that element. I'm looking forward to that.
Yeah. Tikki?
Yes, travel to once again meet face to face with my students. That's what I miss the most.
Yeah.
And hoping that the vaccine will allow me to recover from a very severe illness called Zoom-itis. Thank
you. Beautiful. Thank you for that. So I think we've arrived on time in terms of the panel. Personally, I hope that we can do this next year face to face instead of via Zoom. So hopefully we'll be together to switch next year, talking about how well the immunization program has gone. And as this morning we started this track around government investments, we really touched on how government investment is going to be, number one, bolstered by the pandemic, but also in need of significant attention over the next few years, because there's going to be issues around healthcare, issues around catching up people that have had other diseases other than COVID and have not been able to receive care, vaccinations, but also digital health we've touched on quite a bit, and how that's going to help actually hopefully make the healthcare system much better than we know them now and today, and into something where the patient doesn't necessarily always have to go into an hospital to be cared for. So with that, thank you very much for your time. Really appreciated it, and it was a very engaging discussion, exactly as I expected. thank you again, and
Thank you.
have a good evening, morning, and night for us in Singapore.
Thanks, everyone.
Thank
Thank
you,
you.
man.
Thank you.
Everybody.
Bye-bye.
Bye.
Bye-bye.
All right.